Hi, I'm Ricardo Pessoa, engineer, and first I wanted to ask you who has diabetes or has a relative who has it. If you don't, look again, because 10% of the Brazilian population is suspected of having the disease. For these, we created GlicOnLine, our application for smartphone and internet that automates treatment for all types of diabetes in all its therapeutic stages. GlicOnLine has been clinically tested at the clinical hospital of the School of Medicine of the University of São Paulo to improve glycemic control and quality of life of patients with diabetes. How does GlicOnLine work? Physicians and nutritionists prescribe insulins, diets, and medications online. These prescriptions are sent to the patient mobile, who starts to issue warnings reminding to take the medications at the prescribed time, allows patients to follow diets, choosing foods and household measures, and receiving immediate feedback of the prescribed nutritional limits, and, if insulin dependent, the patient can receive the exact insulin dose calculated according to his/her prescription to compensate blood glucose levels and to cover meals. All this data is sent to a cloud-based electronic medical record available to physicians, nutritionists, and caretakers in graph and table specially designed to facilitate medical analysis. Why this is relevant? Because 370 million people worldwide had the disease. From these, 13 million are in Brazil, where, despite of costs around 20 billion reais in 2011, results are not encouraging. Over 80% of Brazil population with diabetes have glycated hemoglobin greater than 7%, showing poor glycemic control. And why glycemic control is relevant? Because all costs and risks of developing chronic complications of diabetes grow exponentially with glycated hemoglobin, that is, with poor glycemic control. If the patient keeps his/her blood sugar levels under control, he/she will have costs and risks similar to a person who does not have diabetes. And how does one achieve glycemic control? Following treatment. The problem is that the treatment is complicated, requires to take a lot of medication several times a day in different doses, doing math at every meal, calculating nutrients, calculating dose, several times per day, every day for the rest of your life. That's why it's complicated. Noting that 75% of the Brazilian population is functionally illiterate, for many patients, it's not a matter of not wanting to follow treatment. It's a matter of not understanding the treatment or not being able to do the math. And was thinking about this patient that we built GlicOnLine, those who want to treat themselves but are not able to do it. With GlicOnLine, what happens? More patients can follow treatments correctly. Doctors, nutritionists, and caretakers can follow up their patients over the internet, improving their performance. And more, GlicOnLine assures everyone, patients, caretakers, physicians, and nutritionists, that treatment is being followed correctly. And this has value for whom? First, for the patient, who can achieve glycemic control more easily, improving his/her quality of life. Second, to doctors and nutritionists who can work online, increasing their productivity, assure that the patient is following the prescription correctly. Public and private healthcare, which now has data for management and control. Another important point, which is another value, is the increase in the reach of specialists. Brazil has less than 5,000 endocrinologists to 13 million patients. It is essential to increase the reach of these experts. Another major stakeholder is the pharmaceutical industry, for whom greater adherence to treatments means more sales. But now, how do we transform the value we bring to the GlicOnLine ecosystem in revenue? Through a model of software as a service. We sell GlicOnLine license directly to patients, doctors, and nutritionists on our website and in Google Play. We sell license also at wholesale prices for the pharmaceutical industry in a sponsorship model. To public and private health, we provide GlicOnLine, configured for goals specific of each health department, of each company, of each interest group being treated. Plus, we transfer all medical technology required in the form of consultancy, training, support, second medical opinion, enabling excellency in diabetes care and management. And this excellency in diabetes management is our offer to private and public health. And what's our secret? This mixture of personal experience and scientific knowledge that is embodied in my partner, Carla Mello. Carla is PhD by USP in endocrinology and is one of the leading experts on diabetes in Brazil. Carla also has diabetes type 1, insulin dependent, and this is a unique view of researcher, diabetes educator, doctor, and patient enabled Carla to conduct our research and development over the past 9 years when we systematically and consistently innovated both in telemedicine and diabetes care. We now have the only solution on the market supporting the treatment of all types of diabetes in all disease stages. We have a solid scientific and institutional background, and we are the first Brazilian mHealth solution clinically tested. What we want? To grow. We have an application accepted and recommended by doctors, patients, and association, able to make a difference in confronting one of the biggest health problems in the world today. GlicOnLine is ready. What we need and seek is partners, customers, investors to grow.